Hello friends, welcome to my channel. Today we are going to talk about some important question for NEET, BSc Nursing Paramedical CUET and other entrance exam from the chapter Reproductive and Health. This is our fourth part of our series. So let's start the video. Question number first. The first nation in the world to initiate various action plans to at national level toward attaining a reproductive society is A. India, B. China, C. USA, D. Norway. The correct answer is A. India. India is the first nation in the world to initiate various action plans at national level. Question number 2. According to World Health Organization, reproductive health means a total well-being in all aspects of reproduction, that is A. Physical, B. social, C. emotional and behavioral, D. all of the above. The correct answer is D. all of the above. Full form of RCH. A. Reproductive healthcare programs, B. Reproductive and healthcare programs, C. Reproductive and classical healthcare programs, D. Reproductive and child healthcare program. The correct answer is D. Reproductive and child healthcare program. Question number 4. Saheli, an oral contraceptive for female, was developed by A. aims Delhi, B. IICB Kolkata, C. SGPGI Lucknow, D. CDRI Lucknow. Correct answer is D. CDRI Lucknow. Saheli is an oral contraceptive made by CDRI Lucknow. Question number 5. Which is the once a week pill? A. Saheli, B. Mala, D. C. Mala N, D. both A and B. The correct answer is A. Saheli. Question number 6. In tubectomy, a small part of fallopian tube is removed or tied up through A. vagina, B. ureterus, C. a small incision in the abdomen, D. either A or C. The correct answer is D. either A or C. Vagina or a small incision in the abdomen. Question number 7. What is the function of IUD? Option A. Inhibit ovulation, B. increase phagocytosis, C. inhibit fertilization, D. both B and C. The correct answer is D. both B and C. increase phagocytosis and inhibit fertilization. Question number 8. Volt prevent conception by A. phagocytosis of sperm, B. releasing hormone, C. killing ovum, D. blocking the entry of sperm. The correct answer is D. blocking the entry of sperm. Volt prevent blocking the entry of sperm. Question number 9. In vasectomy, a small part of vas deferens is removed or tied up through a small incision on A. abdomen, B. scrotum, C. testis, D. either A or B. The correct answer is D. either A or B. abdomen or scrotum. Question number 10. Which is the safest method of birth control? A. termination of unwanted pregnancy, B. sterilization technique, C. the rhythm period, D. the physical barriers. The correct answer is B. sterilization technique. Safest period is the sterilization technique. The most effective method for ladies: A. rhythm period, B. ECP, C. MTP, D. CUT. The correct answer is D. CUT. Question number 12. Government of India legalized MTP in The year A 1951, B 1971, C 1981, D 1992. The correct answer is B 1971. Government of India legalized MTP in year 1971. Question number 13. Medical termination of pregnancy MTP are considered safe. How many weeks? Safe how many weeks of pregnancy? The correct answer is B 12 weeks. Question number 14. Hepatitis B and HIV can be transmitted from one person to other by A. Sharing of injection needles, surgical instrument with infected person. B. Transfusion of blood. C. From infected mother to fetus. D. All of the above. The correct answer is all of the above. D. Question number 15. Sexually transmitted disease affecting both male and females genitals which often damage eyes of babies born to infected mothers is. The correct answer is B. Gonorrhea. Question number 16. Through all persons are vulnerable to STD. Their incidents are reported to very high among persons in the age group of very high chances. In which age group is that? 15 to 24 years is the correct answer. Question number 17. Which of the following diseases are not completely curable? Option A hepatitis B, B HIV, C genital herpes, D all of the above. The correct answer is D all of the above are not curable completely. Question number 18. The reason of infertility could be A physical or psychological, B congenital or immunological, C drugs and disease, D all of the above. Correct answer is D all of the above. Question number 19. Stage transferred to uterus after induced fertilization of ova in laboratory. A. Embryo at 2 blastomere stage. B. Morula. C. Zygote. D. Embryo at 4 blastomere stage. The correct answer is B. Morula. Question number 20. A childless couple can be assisted to have a child through technique called gift. The full form of this technique is A. Gamete intrafallopian transfer, B. Gamete intrafertilization and transfer, C. Germ cell internal fallopian transfer, D. Gamete inseminated fallopian transfer. The correct answer is A. Gamete intrafallopian transfer is the full form of gift. D. Gamete inseminated fallopian transfer. The correct answer is A. Gamete intrafallopian transfer is the full form of gift. Question number 21. Condoms are the one of the most contraceptive because Question number 21. Condoms are one of the most popular contraceptive because of the following reason. A. These are effective barriers for insemination. B. They do not interfere with coitus act. C. These help in reducing the risk of STD. D. All of the above. The correct answer is D. All of the above. Question number 22. Which of the following method of birth control can cause excessive menstrual bleeding, pain, inflammation of uterine wall? Option A. Condom. Option B. Cervical caps. Option C. Oral contraceptives. Option D. Intrauterine device. The correct answer is option number D. Intrauterine device. Question number 23. In which of the following technique the embryos are transferred to assist those females who cannot conceive? First, gift and gift. B. ICSI and gift. C. Gift and ICSI. D. Gift and out. The correct answer is D. Zipped and out. Question number 24. Progesterone alone or in combination of estrogen can be used as a contraceptive in the form of A. Injection only. B. Pills, injection and implants. C. Pills only. D. Implants only. The correct answer is B. Pills, injection and implants. Question number 25. Select the hormones releasing intrauterine device. A. Volt LNG20. Option B. Multilode 375 Progestad. C. Progestad LNG20. Option D. Lepus loop Multilode 375. The correct answer is C. Progestad LNG20 is the correct hormone releasing device. Question number 26. In case of couple where the male is having a very low sperm count, which technique will be suitable for fertilization? A. Intrauterine transfer. B. Gamete intracytoplasmic fallopian transfer. C. Artificial insemination. D. Intracytoplasmic sperm injection. The correct answer is C. Artificial insemination is the correct sequence. Question number 27. Which of the following is not an IUD? A. Volt. B. CUT. C. Multilode 375. D. Progestad. The correct answer is A. Volt. Is not a IUD. It's a barium. Number 28. Embryo with more than 16 blastomere formed due to in vitro fertilization is transferred into A. Fimbriae. B. Cervix. C. Uterus. D. Fallopian tube. The correct answer is C. Uterus. Question number 29. Ectopic pregnancy are referred to as A. Implantation of embryo at site other than uterus. B. Implantation of defective embryo in uterus. C. Pregnancy terminated due to hormonal imbalance. D. Pregnancy with genetic abnormality. The correct answer is A. Implantation of embryo at site other than uterus is known as ectopic pregnancies. Hysterectomy is a surgical removal of A. Vas deferens. B. Mammary glands. C. Uterus. D. Prostate glands. The correct answer is C. Uterus. Question number 31. One of the legal method of birth control. A. By premature ejaculation during coitus. B. Abortion by taking an appropriate medicine. C. By abstaining from coitus from day 10 to 17 of a menstrual cycle. D. By having coitus at the time of daybreak. The correct answer is B. Abortion is an appropriate medicine. Correct answer is B. Abortion by taking an appropriate medicine. Question number 32. Which of the following cannot be detected in developing fetus by amniocentesis? The correct answer is A. Jaundice. Question number 33. Which of the following is the most widely accepted method of contraception in India as at present? A. Cervical caps. B. IUD intrauterine device. C. Tubectomy. D. Diaphragms. The correct answer is V. IUD intrauterine device. Question number 34. Donor semen is introduced into uterus through A. Intrauterine transfer, intrauterine insemination. C. Gamete intrafallopian transfer. D. Intracytoplasmic sperm injection. The correct answer is B. Intrauterine insemination. Question number 35. Select the option including all sexually transmitted disease. A. Gonorrhea, malaria, genital herpes. B. AIDS, malaria, filariae. C. Cancer, AIDS, syphilis. D. Gonorrhea, syphilis, genital herpes. The correct option is D. Gonorrhea, syphilis, genital herpes are all including sexually transmitted disease. Thank you.